Albert, thank you so much for taking a little bit of time to talk about what you're doing around data governance at UCLA Health. Maybe before we get started, could you give a little bit of background on your role and your scope of responsibilities?
Sure, and thank you, Felix, for inviting me here. At UCLA Health, I serve as the Senior Director of Enterprise Information Architecture. So that includes the roles of data architecture, setting up the infrastructure to pull data together from our various systems for analysis, building out an enterprise data warehouse, as well as the foundational data marts that would sit on top of that EDW. Data governance itself has come into my wheelhouse within the last year, and so getting up to speed on Collibra as a product and whatnot has been an interesting part of the journey.
Great, I'd love to hear more about that. And before we get to that, can you talk a little bit of how data governance became an important topic at UCLA? What were like the drivers that you guys started to look at actually data governance?
Yeah, absolutely. So in the office in which I served, which we call the Office of Health Informatics and Analytics, we serve as part of a centralized IT organization. And in our existence for almost 5 years, what we call enterprise information management has always been a key pillar of our office's set of services. So in the first 3 or so years of the journey, a lot of the advancement has been in setting up major organizational structures to get data governance going. The establishment of Data Strategy and Governance Committee filled with high-level executives to oversee our work. The establishment of prioritization committees to set up a service workflow to deal with the endless number of requests that come into our office. And setting up a set of federated analytics teams, which we call centers of excellence.
Right, interesting. Would you mind sharing some of the concrete examples, like of challenges that weren't going ideal, that kind of drove you to actually start all of that, setting up that data governance organization that you could share, like that are very concrete?
Yeah, so there, in a sense, there was a lot of data that hit healthcare in general, not just UCLA Health, with the transformation of going from paper to electronic health records. Yep. So this digitization led to this explosion of data. And ahead of time, we knew that it was going to be an issue of having to sort through this multitude of data. Who would be in control of it? Is it clinical? Is it financial? So setting up some kind of touchstone for that was important. But as we've gone on this journey, we've gotten into concrete issues, concrete challenges that we've had to overcome.
Yeah. Interesting. You mentioned requests that you got from different part of the organizations. Like what type of requests are that typically?
Yeah, so as our EHR program started up back in 2013 or so, just knowing what was going on was very important. So a deluge of typical ad hoc requests, the transformation of standardized reporting from our legacy systems into our new electronic health record was a major challenge. And where do you start? How do you prioritize that? Which business groups do you put first in line versus others who need to wait?
Right, so the whole coordination almost around that.
Yes.
Interesting. And so as you started on that journey towards data governance, you looked at Collibra, you've kind of made an analysis. I guess you looked at the market. What made you choose to partner with Collibra?
Yeah, so actually within the first 3 or so years, the office had another tool that it had used, and it achieved limited success. So back around a year or so ago, I talked to a colleague of mine at one of our sister University of California campuses who was very passionate about Collibra. That person served as a medical informaticist, and there was something about Collibra's emphasis on modeling and ontology and that kind of theory that married well with healthcare in general. So we decided to have our own instance. We went live on it last year, got our contract signed in and stuff. And so we're in the process of stepping up that program, getting our production instance filled with a number of friendly customers.
Perfect, sounds exciting. So next to the kind of our background that you write on kind of the semantics and the ontologies, were there other kind of things that jumped out that you liked about the platform that were maybe different from the others?
Yeah, I'd say in our prior platform and other solutions we've seen, a lot of the emphasis was on organizing a lot of artifacts, for lack of a better term. We have a lot of reports, there are a lot of tables in a database, and it was kind of an intuitive way of approaching enterprise information management. Whereas with Collibra, before we even saw a product, we had a framework of thinking, the idea of thinking of information as a set of assets with business and data, governance and technical. We were completely, our interest was piqued by listening to that different way of thinking of things.
Interesting.
And the relationships among those assets gave us even more of a sense of how to operationalize that in our real life.
Absolutely. So kind of the structure that the product gave you, how to organize and think about these different types of data or data assets, if you will.
Right, and that influenced then how our operations would move, how our people would think about information as an asset.
And speaking about people, how have you, because we believe it's critical that ultimately governance is about coordination around people and making sure people collaborate around data. And we can do that formally through workflows and informally through our social features. Is that something that you've started using?
Yeah, so getting people exposed to the product, so in healthcare, figuring out clinical quality measures is a very important concept, trying to prove that we're taking care of patients, that we're providing good value and not harm. So instead of having, say, development teams just create these measures on the fly in an Excel spreadsheet or on a whiteboard or some other place like that, we'd want them to memorialize all of the inputs and outputs in Collibra first before they write a line of code to even get that going. And getting their exposure that way kind of onboards them well. Interesting.
And if you think about the kind of the users of Collibra as a product, you talked about the developers, like what other groups of people are actually using the product directly or indirectly?
Yeah, so beyond the, say, hardcore developers, we have regular business folks who would just want to know if a particular report existed, and they'd want to know who created the report, who is the sponsor. Whereas in the past, we wouldn't necessarily record all of that information. But since Collibra had a very prescriptive way of thinking of assets and the attributes that go along with it, it would just be a prompt to us that, oh, yes, we need to go ahead and account for something as simple as who a report owner is and how to contact them.
Interesting. That makes sense. So if you think back of what your life or your world, if you will, was before you started with Collibra, and now as you've started to implement Collibra, what are the big differences that you can already see that have provided value?
One is just getting the people excited about data governance, the team itself as well. Not just our business-facing staff, but our technical staff, where we all share a same platform of making transparent our work. And that alone gets our technical and business folks together and in a more collaborative environment. It also gets us in an open community with our customers beyond our centralized BI and analytics team, to where reporting isn't as mysterious anymore. They can see lineage, they can see the home of data within our electronic health record, and they can trust us more.
Interesting. And so that's where you are today. Like, how would you describe where you would like to be, like in a year or 2 years from now? What would you like to kind of achieve from a planning perspective?
Yeah, so we see the launch of Collibra under our Respawn data governance program, if we want to call it that. We're trying to marry that up with our self-service analytics strategy. Where in order to create these beautiful visualizations in that environment, you need the metadata in Collibra to help understand what are those building blocks of the analytics that you need to do. So with our community at about, say 150 or so users out there, we want to see that grow. We want to see more specialization within those communities, and we want those communities to build upon the work of one another to create a better product instead of existing in silos and doing their work in isolation.
Interesting. Sounds very exciting.
It is.
Albo, thank you so much for spending the time, and I'm looking forward to hear how it's going over the next couple of years.
Very good. Thank you very much, Felix.
Thank you.